Thank you, Supervisor De La Cruz.
Thank you, Mr. Chairman.
Can I have a motion for a certificate of posting? Second. All those in favor say aye. Aye. Opposed? Hearing none. We'll move on to public comment, and this is for items not on today's agenda. Please keep your comments to 3 minutes or less. Do we have any speakers?
Yes, Marvin Jones.
Thank you, ma'am. Mr. Chairman, Board, another round about Agenda 21. We had heard about it before. Some of the precursors were, if you recall, individual ownership of private property is not sustainable, contributes to social injustice. Social justice being a code word for equal results, not equal opportunity, but equal results. We also learned some other things about sustainable development, or what is not sustainable. Plowing of land, grazing of cattle. That's real good for San Benito County. No row crops, no cattle ranches. What else is not sustainable? We found out that appliances, like your air conditioner, your dishwasher, your washing machine, your clothes dryer, are not sustainable. Single-family residents are not sustainable. That was 20 years ago when the United Nations came out with their agenda for the 21st century. Last year was the 20th anniversary. There were another 18,000 people that gathered in Rio from all over the world. And our Secretary of State gave a nice speech about sustainable development and more on climate control than some of the speakers. This book, if you look at CEQA, California Environmental Quality Act, you look at Chapter 8 of this, I'm not sure which one came first. CEQA's got more detail, of course, but there's quite a lot of compatibility between Chapter 8 in this and the California Environmental Quality Act. There's chapters on promoting sustainable human settlements, planning and managing of land resources. Again, these are 20-year-old type things. There have been other documents that come out for more details. Promoting sustainable agriculture. There have been many government, U.S., other nations, many governments, and non-government organizations, the NGOs you hear of occasionally, that have been nudging us towards Agenda 21. California Law SB 375, Sustainable Communities and Climate Protection Act that Governor Schwarzenegger signed in 2008. We got the U.S. Fish and Wildlife. You've heard of the Foothill Legacy, voluntarily sequestering land from future development. Environmental Protection Agency doesn't do the voluntary sequestering of your land. You find a tiger salamander, a kit fox on your property, you can't do anything with it. Corps of Engineers with their wetlands. And then non-government organizations, the Nature Conservancy, Sierra Club, I'll wrap it up, Center for Biological Diversity, which we had input a couple of weeks ago, even the Santa Clara County Land Trust, all striving to sequester land from future development. Next time we'll get into biodiversity. Thank you.
Thank you very much. Any other speaker cards? Anyone else who at this time would like to address the Board of Supervisors? Please, if you could grab a speaker card and step to the podium.
Natural and cultural resources element. Hi, my name is Eric Larson, and I'm a representative of SEIU, United Long-Term Care Workers. We represent about 350 IHSS care providers here in this county. And I'm here today to once again make a point about the Affordable Care Act. As a result of the Affordable Care Act, there is an opportunity for San Benito to reopen the contract for care providers. In fact, there's a provision within our contract that says when the percentage of federal dollars and the funding mix for home care changes, that triggers conversations about a wage increase for care providers. There's new monies that have come to the county, and these monies should be designated in the right place for care providers to increase their wages. And I ask the Board of Supervisors and the county administration to set a date as soon as possible to begin a first meeting. We have asked for a meeting several times. We have not gotten that. And we ask the county and the administration to honor that request today. Thank you.
Thank you.
Good morning. My name is Kathy Ruiz Goldenkrantz, and I am from Santa Cruz County. I am a leader in COPA, Communities Organized for Relational Power in Action. I am the chair of the Santa Cruz Healthcare Team. Last year, COPA expanded into San Benito County, and we now have institutions totaling 24 in the 3 Monterey Bay counties. One of our issues within the healthcare team is to ensure that the healthcare workers have a decent wage. And that's why I'm here this morning, to ask the Board of Supervisors to direct the county administration to meet with SEIU and to get those negotiations started. Y'all know that $10.50 an hour is not very much. $11.50 an hour is not very much. $12.50 an hour might be enough to live in California, in this particular area of California. I would ask that you give great consideration to meeting with these people who work very hard to care for the disabled in our community and give them at least the right to a voice and someone to listen. Thank you.
Thank you. Anyone else?
Yes, we have a Dean Lundholm.
Dean Lundholm. Hello, my name is Dean Lundholm. I'm a COPA leader through Live Oak Family Resource Center in Santa Cruz County, and I'm here today to support this effort to see that contract negotiations and discussions can begin. These workers are very important to us, to our community, and they deserve enough money to live on. Thank you.
Thank you.
We have Cindy Valdez.
Good morning. My name is Cindy Valdez. I am an in-home supportive services care worker. I care for my mother and my significant other. I've been doing this for 4 years. I have to tell you, $11.50 an hour in Santa Cruz County is not enough. $10.50 an hour is certainly not enough in San Benito County. As mentioned before, California is a very expensive place to live in. And as a member of COPA, of the health team, as well as the Live Oak Family Resource Center, I am committed to help my sisters and brothers to do this kind of work. And we should prepare ourselves for the baby boomers who are going to be retiring soon, and we should be supportive of the people who provide care for these folks. Thank you very much.
Thank you. Anyone else who would like to address the board? If not, we'll move on to
Mr.
department head announcements.
Mr. Chair, can I respond to that? Yes, just for the record, I've directed our labor relations team, Renee Sloan, Holtzman, and Sakai, to contact SEIU with regards to this. They've actually written a response to you with no reply, so we'll get your contact information and make sure that we're on the same page, and we can set a date to meet with them, just
Okay.
so the board's aware of that.
Thank you, CEO Espinoza.
Yeah, we do have a few announcements. One I'd like to bring to the board's attention. We'd like to go ahead and remove item number 19 from the agenda, the consent agenda. There's some more work that needs to be done with this particular item. I also have a couple of more announcements from department heads. We have Joe Paul Gonzalez, our auditor, controller, recorder, that has a department head announcement.
Good morning.
Morning.
Board of Supervisors. In order to get ahead of the curve for the March 31st deadline for submission of the single audit to the State Controller's Office and to the Federal Audit Clearinghouse, we have met at the Audit Committee level to discuss a calendar that was created in my office and distributed to all department heads, and again discussed at the Audit Committee level what are the requirements from each department to be able to close the end of the fiscal year and to create the financial report that is required of us, required of the county every year. So on this calendar that was distributed are the specific requirements for all departments, kind of the answering the what and the when, because it actually has dates of when we would like them completed and submitted to the auditor's office. Hopefully, we can this next we can close out the 12-13 fiscal year and be prepared to submit the complete CAFR to to those agencies prior to March 31st.
1 second. I think there's a couple questions from the board. Supervisor Munzer.
Thank you, Mr. Chair. Joe Paul, thank you for bringing this before us. I would like this agendize for our next meeting. It could even be on consent, but I like for the calendar to be in front of all of us. And we are still having some issues with some of the departments getting the accounting records in on a timely fashion. Our outside calendar, I think we're all aware, was actually working on Easter Sunday this past year to get our report in on time, and that's just unacceptable. So we got to get the materials they need on a timely basis, and I think this board needs to stay on top of that.
Yeah, that was kind of where my thought process was as you were giving your report, Mr. Gonzalez, was that when I was on the audit committee, you had a schedule of different timelines that we had to meet, departments submitting reports, and at the end of the day, the department struggled to meet those deadlines, and I think now that we're into a fresh year, we got to make sure that hopefully we do a better job at that, where you don't have to work on Easter to get it in. And it's really important to know, if the departments have the support that they need to meet your milestones, so to speak. So I think Supervisor Munzer brings up a good point. I think it should be agendized, and this board needs to stay on top of it. Anything else?
No, that was it. Thank you.
Okay.
I'll make sure that it's on the agenda.
Yeah.
For the next meeting.
Okay, thank you.
Yeah, we have one more announcement. We have Ellen Yamamoto, our Director of Behavioral Health. He has a department head announcement.
I just have a quick public information announcement that Supervisor Barrios requested that I make. We are required to create an annual Mental Health Service Act plan update, and the plan update has other requirements for public posting. It requires a 30-day public posting for the ability for the public to comment, and then it culminates in a public hearing. That public hearing will occur on July the 18th, which is a Thursday, and it will occur at 12 o'clock in the Behavioral Health Department conference room. So I just wanted the public to be aware of that.
Okay.
Thank you.
Thank you.
Mr. Chair, the reason I requested that is because I do sit on the Behavioral Health board, and I felt that this venue would really be able to inform the public. They're able to see it on cable, on live feed. And so it's just another opportunity for folks to be able to get informed and be able to perhaps give us input on this requirement that we have to meet.
Great.
Thank you.
Thank you, Supervisor Barrios. Any other reports, CAO?
No, that's all I have for department
Okay,
announcements.
thanks. We'll move on to board announcements. I'll start with, Supervisor De La Cruz.
Thank you. First of all, I'd like to thank the City Hollister and Ignacio and Robbie Scatini for providing the leadership for the rally that we had over the weekend. I believe it was a success. There might have been some minor issues, but I mean, to have a lot of crowd for some minor issues, it's a good risk to assume. I just hope that this is the beginning of more rallies to come in San Benito County and specifically in Hollister. We also attended the COG meeting, and we did discuss about the Pinnacles Highway situation, and I
It's
believe
called Airline Highway.
I'm sorry, Airline Highway. Call it the way you call it. Call it the way you want to call it. It was Airline Highway. At the meeting, it was voted 3-2, correct, the Chairman Patalo, to push back the requests of Anthony Canela. Right, like 2 hours after that happened, I heard Assemblymember Luis Alejo has now sponsored a bill to name that part of Monterey, that highway, National Pinnacles Highway, and they're pushing forward on it. Just for some information for the board, and also I'd like to thank my brothers and sisters for joining a wonderful birthday present that I got on my birthday. However, one of those birthday gifts was a ticket to the Dodgers-Giants game, and I hated the game because the Dodgers won. But, you know, other than that concludes my report, Mr. Chair.
Okay, thank you. Supervisor Munzer?
Thank you, Mr. Chair. On Monday, the 24th, Supervisor Barrios and myself attended a tour that was hosted by the Hollister Hills people of the Clear Creek area. There was many dignitaries and experts that was involved in this tour. Among them was Congressman Sam Farr, our own Sheriff Darren Thompson, Field Manager of Bureau of Land Management Rick Cooper, retired General Anthony Jackson, Director of the Department of Parks and Recs for the state of California, and retired Colonel Chris Collin, Deputy Director of the OHMVR Division of the Parks and Rec for the state of California. And basically, the Hollister Hills were giving a tour for these people, especially the General, the Colonel, and the Congressman, to show them that Hollister Hills could be reopened as a motorcycle park. We had a geologist expert from both the feds and the state, and they were arguing over whether the asbestos is dangerous or not. So it was kind of a rehash of what happened at our own Vets Park, or Vets Building, Vets Memorial Building a couple years ago. So the federal government and the state government are still arguing over the danger of asbestos down there. But if we want Clear Creek open up as a motorcycle park, it's going to take the passage of Congressman Farr H.R. 1776 bill, and I told the congressman I'd be happy and willing to fly back to Washington again and speak to the subcommittee. But it was a very good tour, very good day spent down there.
Very good. Well, you're very effective last time you were in Washington, Supervisor Munzer, and thank you very much for volunteering your time to do that. Supervisor Barrios?
Thank you, Supervisor Munzer, and I love the way you step up to the plate. Yeah, it's commendable. But no, we really we will take that opportunity. If it means opening up Clear Creek, I think we need to have representation. Congressman SAMFAR brought to our attention the example of the Yosemite El Capitan, where it's a national park. They allow people to climb that. They have deaths every single year from that, from being able to do that. Why? And we haven't had anything like that in San Benito County at Clear Creek, and yet they closed it up as an emergency. So we still need to be advocates. We need to be very diligent about moving forward and getting Clear Creek opened, because it is really not acceptable for San Benito County. Highway 25, thank you, Supervisor De La Cruz, for bringing that up. That's what we, at this point, we're waiting for it to go through COG, and Supervisor Munzer and I will still continue the effort to meet with the folks that are interested in keeping the name Airline Highway and trying to do our research. We have the Downtown Association and the Chamber of Commerce helping us move through this effort. I attended, as well as some of the other supervisors, the 80th Rodeo event, and that is a tradition that never gets old. It was a beautiful event, well attended. The weather was so hot it was unbearable, but like I said, it was well attended, and a lot of families joined us in the activities. I also attended the rally. I attended it on Friday and on Saturday, and I talked to the manager of the city, Clint, at the time. I think he's still with us, and he said that there were no major glitches that he was aware of, so hopefully this was a real boost for the city of Hollister and the county of San Benito. So I'm sure that we'll get information at a later date. Thank you, Mr. Chair.
All right, thank you. And we won't ask you to show your new tattoos.
I will not show it. Private.
Okay, we'll move on to the consent agenda. We're pull item 9, 17, and 19. Would the public would like to pull any other items? Seeing none, I'll have a motion.
Yes, I do have
Oh,
for 36.
which one?
Oh, I'm sorry, that's covered.
Oh, okay. Oh, so we're okay, we're good to go with the
We
three.
pushed out 19, right? We removed
Yeah.
19. Okay.
19 is pulled, or continued. Continued. Okay, item 19 is to be continued. 9 and 17 are pulled.
Motion to approve amended, Mr. Chair.
All those in favor say aye.
Aye.
Opposed? Hearing none. Supervisor Barrios.
Thank you, Mr. Chair. I talked to Alan over, I think it was on Monday, I can't remember. Was it yesterday, Alan, that we talked?
Yesterday, yes.
Was it yesterday? The days go by too fast. But there is just a slight error on the approval on the recommended action. It states that it is a 21,000 prior year rollover, but it is in fact 31,000. And Alan did say that, yes, that is the correct amount. So I want to make sure we note it before we approve it.
Yes, I had a fat finger keystroke error and hit the 3 instead of the 2.
Or
I
hit a 2
apologize.
instead of a 3.
The 2 instead
Right.
of the 3, yes.
So I just wanted to bring that to the attention so that we do approve it correctly, and we don't have to come, Ellen doesn't have to bring it back. So,
Mr. Chair,
Supervisor De La Cruz.
I was going to pull that item, but I saw that Margie pulled it. And my question is that the carryover.
Yes.
Is that an allowable activity to carry over funds from a prior year grant allocation?
Yes, it is.
It is. Okay.
There's reversion on some of the funds, and there is reversion on prevention and early intervention money, but we're within the reversion timeframes.
And this 31K that was rollover to this year from prior year, it was also related to Hollister Youth Alliance and for mental services?
Correct.
Okay.
They have turnover like we all do, and sometimes they have empty positions.
Okay.
Any other questions from the board? Any questions, comments from the public?
Actually, I had to slip in on number 9, Marty Richmond from Hollister. I reviewed the behavioral health plan and some of the statistics there, and I am a supporter of the Hollister Youth Alliance. I think they do a hell of a good job, but I do have one concern. Looking at all the statistics in behavioral health, and there's a lot of them, and I encourage the members of the public to read the reports. You see that within some reasonable breakup, that the populations are all being served. But on the Hollister Youth Alliance, I don't know if it's an error on their counseling statistics. Over 94% of those youth counseled were Hispanic. And I know the Hollister Youth Alliance serves all the youth in Hollister, not just the Hispanic youth. So I am concerned that perhaps the other youth in the county and in the city are looking upon this as a Hispanic organization, because that seems to be an overwhelming number, 94.4%, I'm doing this from memory, Hispanic on the youth counseling. One would think that all the other ethnic groups in the youth population are also having proportional issues. Not exactly the same, because there's a difference a lot of times in income, education, experience, so on and so forth. But within the realm of possibility, I think 94-something% is a huge number. So I encourage the Youth Alliance, especially if they have some rollover money, to do some outreach and to, if that number is accurate, that 94-something%, to do some outreach and make sure that the rest of the population, ethnic populations in this area, understand this is not a Hispanic organization. This is a local organization for everyone. Thank you for your time.
Thank you. Anyone else from public? If not, I'll bring it back to the board for a motion.
I will move to approve per staff recommendation with the change of the total inclusive of 21,000 change to 31,000 for the prior year rollover.
Second.
All those in favor say aye.
Aye.
Opposed? Hearing none. Move on to item 17, Supervisor Barrios.
Thank you, Mr. Chair. I'd like to go to that item and bring it up. I think probably the thing that really stuck out for me on that report is the number of days that are still out there that have not been used. And in the last 6 months, the employees only utilized 10% of that. And the concern that I have is that, are they being informed regularly of their hours, that they need to use them, that they can only, we now have different banking numbers, so to speak. And so I just want to make sure that we're doing our job in informing them of this.
Thank you. Let me try to respond. Georgia Cochran, Interim HR Director for San Benito County. And the intent of this report, as I understand, you got a verbal report last time. We were trying to give a little more detail for your board to see exactly what's going on. This was not an intent to single out anyone. I want to put that up front. But we did want to give you that sufficient detail. I do know the employees are working hard. Unfortunately, sometimes things like this penalize when you have furloughs and a lot heavy workloads and reduced staff. It penalizes some of the employees who seem to be working the hardest. I can't say specifically exactly how often employees are notified or departments get regular reporting. I will check into that and report back if you like. What we can do is I can ensure that we will get some kind of reporting and distribute that to department heads on a monthly basis. I think we can make that commitment in HR, and I'll work with the auditor's office to get that detail so that we can push that. I was happy that it went down. It always worries me when we do something like this and find that maybe there hasn't been much change. So I was a little happier with the 10% than maybe you were, but it is what it is. The numbers don't lie, and we wanted to give you those facts.
Yeah, and I don't need to, Mr. Chair, bring it back. Really, my intent would be that we do those monthly notices would be great to department heads, and just keep it up front to the employees, because you hate for people to lose hours that they've earned. And but I know that is the drawdown that we agree to, and so just want to make sure that that's being done. So.
Okay, well, we will commit to regular reporting and notification so that then it can be managed by the individual departments.
Super, thank you. Thank you, Mr. Chair.
Okay, thanks. Yeah, 1 second, please, Georgia. I know one of the best things we did was put the caps, and these
Yes.
hours were accumulated before the caps are in place, and that's our best move. And I just can't remember off the top of my head when I was going through this myself. These hours are capped at a value too, aren't they?
Mr. Chair, I'd like to answer that. Yes, they are. They're a value at the rate that the employee was what their monthly or yearly income was, or their wages were at that point. That's what it was capped at.
Okay. Yeah,
So.
because to me it makes sense to those old hours should be capped at a certain value, and then that would help you use them up too. So anyway, all right. That was a question I just wanted to be clarified in my mind. Anyone else?
Mr. Chair,
Supervisor De La Cruz?
I was going to ask that question and follow up to that question. Is it a FIFO system where first in, first out, or the last in, first out when you use your vacation?
I believe my understanding, and again, I'm new to the block, but is that it's designed to give the incentive to use those hours.
Yeah, but see, my question isn't, this is in terms of value, is that if you have a pocket of hours over here at $10 an hour, are they using those hours first?
Well, there's a cap. Yeah, the new, Mr. Chair, the new hours are capped, so they cannot go over those new hours. So they have to use the new hours, as well as use the banked hours to meet that requirement that your board has put in place to have a certain cap as well on the banked hours. So the employees have been, the directors, we have actually had department head meetings to discuss this in the past, not quite monthly, but we have discussed this. It's a juggling act because we had 120 hours of furlough, we had our regular, banked, we had our banked hours as well as our regular vacation. So there was quite a lot of things going on there, and so we've been juggling that. So I think the 772 hours is actually a good number based on where we've been at the last year.
It's still not answering my question. Here, let me try to rephrase my question. And I remember we had these discussions, and I was confused when we approved it, and I said, okay, I'll need to talk to Joe about this so we can get a handle on this. So if someone has 600 hours of bank, it's frozen, and there's a value on those hours, and let's just assume for academic purposes it's $10 an hour. And then 5 years, 6 years down the road, your new hourly wage is $20 an hour. When you take vacation, and it's to lower that cap, the 2x cap. When you take that vacation, when you get that paycheck, is it based on the $10 an hour, the bank, or is it based on your current hourly wage?
Okay, so to answer your question, I'll need to, travel a little distance before I get there. The employees use their current, bank number 2, what they're currently earning, they use that up first.
Okay.
If they are taking, they're encouraged to take more time off, then it goes into, the banked hours,
Okay.
bank number 1.
Number 1.
And as we look at those hours, we are computing what the pro-rata share of those hours actually, actually get them in time off. So if they took off, let's say they're getting $15 an hour now,
Okay.
and those hours were at $10 an hour, then we would have to compute the equivalent, usage of that bank to meet those to meet that hour.
So we can't set a dollar figure at those hours. It's going to be prorated when you do use those vacation hours.
Well, they do have a fixed dollar amount, but as a person's wage changes,
Right.
that number stays the same for the value of the banked hour,
Okay.
but it changes the proportional usage of those banked hours.
Yeah. The new bank 2 in this case, those hours, value of those hours will increase depending on when you earn those vacation hours. at the time of your salary, correct?
Well, yeah, those don't have a cap on it. So, you know, if you're holding on to those, but remember, excuse me, let me change the language a little bit. That bank of hours does have a cap now, but the value of the value to each hour, that is not capped, because that changes as, person's salary changes.
On the bank number 2,
Yes,
not bank number 1.
correct. Bank number 1, that is a fixed dollar amount.
Okay, so let me
Correct.
just ask a real simple question. Do the hours on bank number 1 ever increase?
No.
Okay. All right, that should ask that question. Yeah. Thank you.
Thank you. Any other questions from the board?
Just a comment. I just want to say thank you, Georgia, for bringing this to us. I know that it's in more detail than before, and maybe that's why we have more questions, but it's a good thing. It's very transparent, and I appreciate the hard work that was put into it.
You're very welcome, and that is the goal, is so that you understand what is happening. I do think the furloughs ended on June 30th. I don't know what may or may not come about for this next fiscal year, later on in the fiscal year, but I would hope and expect some, absent furloughs, some significant decreases in those hours as a result of that.
Right.
Because you don't have the additional burden of taking the furlough days and still trying to get the work
And
done.
try to get the banked hours. Okay, thank you, Mr. Chair.
Great. Any comments or questions from the public? If not, I'll bring it back to the board for a motion.
I don't think it requires a motion, Mr. Chair. I think it was information only. Is that correct, Ray?
Yeah, it was sorry.
Or counsel?
It was just a status report to you.
All right. And I probably, I was informed I should have pulled 18. We did not. We voted on it, but I will open up public comment for item 18. Someone from the public asked to be able to comment on item 18.
Mary Schneider? Mr. Chair, if I may, because number 17, even though it doesn't require a motion to approve it, it is part of our consent agenda that we normally approve in totality, the whole thing. So maybe we are required to make a motion because it is part of the consent. I might be wrong, but I just wanted to make sure we didn't have to come back to it.
Well, normally we would approve the consent as a whole, so that would get caught up in it, but technically there's no need to move on it. It's just to receive the
Okay.
report. If the board wants to make a motion and vote on it, it can, but there's nothing really to vote on.
Okay, very good. Thank you, Mr. Chair. Just wanted to bring
Thank
that.
you. And that was my thought process on it, and that's quite all right. Ms. Schneider?
Thank you. I'm speaking as Vice President of the Friends of the Library, as well as a resident, 1044 Monterey Street. I just had questions about 18 because I felt like it was adding a layer of administration to programs, to administer programs and personnel where we've had severe cuts. And it just made me wonder about the priorities of the county. So I'm coming to understand it a little better as I hear confusion and so on, questioning from other people in the audience. Marty tried to explain it to me. But I'm still feeling like I've got questions like, why hire an assistant before you've got the CAO on board? So sorry about that, but I just had questions that I felt like I needed to voice.
Okay. Thank you. Anyone else from the public would like to comment?
I actually have a Jillian Wilson.
Hi, I'm Jillian Wilson. I'm speaking today as president of Friends of the Library and a Hollister resident, 1150 Kimberly Court. Like Mary, I just had questions about where this position was coming from or why it was needed, and maybe it would have been nice to have been part of a public hearing or something where the public might have a little better understanding of why it's needed, where the funds are coming from, and like Mary said, why the assistant's being hired before the CAO is on board. Thank you.
Thank you.
Mr. Chair, for clarification, could we have our CAO clarify, this was not, we didn't hire anybody on this item. What it was just a specification that was changed. The wording of our prior scope and position was changed to reflect, you know, a little more flexibility. So I just thought that we should clarify that for the
Yeah, I was
audience.
probably maybe even after public comment, perhaps the board would like to express a clarification for the benefit of the public as far as, you know, what maybe individually we feel why this position is on the agenda today and what's really happening with the position. It's not a new position, it's an old position, but with some amending to the position to fit the needs that the county needs right now. And we'll do that after we're done with public comment.
I'm Marty Richmond from House. As you know, last time a related item came up in closed session. Both former Supervisor Lowe and I had comments on it because we were confused about what was going on, what exactly was going on in closed session. And I understand there's a requirement because of the Brown Act, when you have a closed session, and the county council certainly complies with this, your AIT or whatever it's called, your routing slip, always has sort of the quote directly out of the Brown Act, why this is allowed to be a closed session item. So it says something like, whatever it says, hiring of personnel, and then it has the paragraph. But when the only thing there is that, then that leaves the question exactly what's going on in the meeting. I think that's why we were confused last time. I think the members of the board will remember that both former Supervisor Lowe and I stood up and were pontificating about what order people should be hired in, and then I believe your response was, well, we're not hiring anybody here, we're just doing interviews or something, or talking about the position, what the qualifications are. So I think one of the things I would ask, just to, especially for the closed session part, while you should continue to put the Brown Act quotation in there exactly, I think you ought to have a half a sentence explaining what you're actually doing at the time underneath that umbrella of the Brown Act. So if you are laying out the specifications for the job, it should say laying out specifications of the job, and the Brown Act is so and so and so and so, which doesn't necessarily say, the Brown Act may say something like anything having to do with the hiring or qualifications or something, whereas this one leaves specifically, and I think that would help the public perhaps follow along in what's going on, in what order. So thank you for your time.
I appreciate that, thank you. Anyone else from the public? Okay, I guess I'll close the public comment, and is it appropriate for the board to comment at this time, or?
Yes.
All right. You know, we had this item in closed session at our last meeting because there was a couple of nuances that required it to be under closed session, and I certainly support staff in putting this item on a closed session. It's an open session right now. We pulled it. We heard from the public. This is an essential position for this county to be able to continue to move forward and complete, the administrative requirements that we have to run the entire county. And it's a established position, one of the positions that were cut earlier during our recession that needed to be amended to be broadened to allow for qualified individuals now and into the future to hold this position as a department head in light that we have intern CAO. It is the board's prerogative to be able to appoint a department head position, and that's where we're at. And it's take a long time to fulfill all the departments back to the staffing levels and the management levels, as well as the rank and file levels that we need to be at. But we have to, start now, and it's, a top priority to have qualified people in place. So that's kind of my statement. I don't know if any other board members would like to add to that.
Mr. Chair.
Supervisor Barrios.
Oh,
No, go ahead.
me first? Thank you. And you said it well. It's a position that we already had. It just hasn't been filled. And really, our intent was to broaden the scope so that this way it would give us more flexibility on what kind of position this is and what responsibilities they have, what are they going to do, who are they going to manage, and the responsibilities really need to be broad, especially after, like you said, there are a lot of departments that have no second in command. And so we need to make sure that when we fill in a position that they are able to do a lot more than prior scope of work. So, so thank you. You said it well. I appreciate it.
Supervisor Rivas?
Yeah, I guess the only thing I can add is certainly the concern that we've heard today is valid, because we're a county that's going through a period of transition. We don't have a permanent CAO in place. So it certainly makes all the sense in the world to wait to see how we're going to build our county, especially our county administrative office. If I had it my way, this may sound very selfish, but I'd like to break this job up into some part-time jobs and get us some staff members. That would be a lot of fun, less burden on all 5 of us, right? But that is probably not likely to happen.
No.
So, but moving forward, sure, this is, we're adopting a class, a specification, but where we go from here, it certainly is, it certainly is going to be a discussion that we're going to have out here in the public as far as, the process that we follow, because I think in the end it is about process. How do we move forward to fill this position when we do fill it? So, thank you, Mr. Chair.
Georgia, you had something to add?
Well, I would just like to tag on to what Supervisor Barrios said regarding the broadening, and what this does is allows the board and the CAO the flexibility to change what the county's needs over time so that it covers a very wide span. No one person can do everything. However, your needs focus in different areas at different times, and hopefully this will not continue to come back to you because it's written broadly enough to carry you through, at least through the future over the next 5 to 10 years.
Thank you. Okay. With that, I hope that provides some information to the public and a little bit of explanation, and hopefully we're all going to move forward, as a whole. We already voted on this, so we'll go ahead and move on to the public hearings, and CEO Espinoza.
Thank you, Mr. Chair. Yeah, we have 4 hearings this morning. The first one is going to be held by Ron Ross. He's our he's the Agricultural Commissioner. And he'll be holding a public hearing to hear objections, protests, and request changes or corrections to the written report regarding the mosquito and disease control assessment rate to be imposed. Adopting a resolution accepting the annual report for the mosquito and disease control assessment and levying the rate of $10.90 per unit mosquito and disease control assessment for fiscal year 2013 and 14 based on the engineer's report. So, Ron Ross.
Okay, good morning, Board. At your June 4th meeting, the Board was presented with an engineer's report for our mosquito abatement assessment and adopted a resolution of intent to levy an assessment based on the findings of the engineer's report. Now, this rate can be adjusted each year depending on the San Francisco Bay Area Consumer Price Index. Since the last time we changed the rate, we have the ability to raise it up to a maximum of $11.15 a parcel. The engineer's report that you received at the last board meeting recommended a rate of $10.90 per single-family equivalent, which is an increase from the existing rate. When the program was first started in 2005, we were able to take advantage of state funding to purchase some capital assets, primarily equipment, vehicles, and so forth. And since that time, we haven't replaced any of the equipment. With this new rate, allows some extra monies to be accumulated so that we can start replacing the equipment as needed. Today, we also have a representative from the company who did the engineer's report in case there's some questions that I can't answer about that report. And at the public hearing, we're here to gather public comment. At the end of the public hearing, you can adopt the findings of the engineer's report and approve the resolution setting the rate for this new year.
Okay. Any questions for the board? If not, I'll go ahead and open the public hearing. Any comments or questions from the public?
Thank you, Mr. Chairman. Best I recall, this Special Assessment District, a SAD, was formed under the Proposition 218 rules, and if my memory is correct, there's a maximum increase of 3% per year. And we didn't get the current rate, so I don't know if this is greater than 3% or not. Y'all can figure that out yourself. Another comment that when the Special Assessment District was formed, we had to eliminate part of the county. Or if you included the entire county, you would have had to have the Prop 13 2/3 requirement versus the 50% plus one that allowed by Prop 218. So what part of the county did we eliminate? We eliminated that strip of the county that goes from Hernandez Reservoir around to San Carlos Creek. San Carlos Creek is the only creek in the county that runs year-round. So we took them outside of the mosquito abatement district, two nice mosquito breeding areas, and I was just wondering if, what do we do with mosquitoes that are bred outside of the SAD and drift into the mosquito abatement district? Do we have anybody at the boundary to keep them from coming in? Thank you.
Thank you. Anyone else from public?
Hi, Marty Richmond from Hollister. I was just wondering if the Agriculture Commissioner can give us an update of I know he has the fish working in the abandoned swimming pools. I wonder if we have a system yet to get the people who abandon the pools and own those properties, whether it's the bank or it's the mortgage company, I don't care who it is, to pay their fair share of this mosquito abatement, because they are using more than their fair share of the services, in my opinion. Thank you for your time.
Thank you. Anyone else from the public? Not, I'll close the public hearing and bring it back to the Ag Commissioner, and maybe you want to maybe expand on.
Yeah, sure,
what
I can
our
respond
program is for
to a couple
pools.
of questions that the public had. He is correct, it is a 3% maximum that we can raise the rate. That's per year. But since we haven't raised the rate in a couple of years, that percentage is actually banked. So it works out to be about 2% of the year that we're actually raising the rate. So we're allowed, like I said, 3%, but we hadn't had a raise. It works out to about a little over 8%.
Okay. Thank you. With that, any questions from the board? If we'll bring it back for a vote. Oh, I'm sorry, Marty. The pool.
Okay, the
swimming
pool thing. That's a good question. That's something that we've, the Health and Safety Code does allow us to take action to recover our costs. whoever it is in our agency that does it, it has to go before the board, and it's actually a pretty cumbersome process. And talking to other districts in the area, they don't go through the process because by the time they get through with it, they spent more money trying to collect the money than it was really worth. And what it amounts to is, I don't recall off the top of my head exactly how it works, but if we identify a pool that's not getting taken care of, we have to come back to the board. We have to present it to you, then you have to authorize us to start proceedings. We contact the person, give them a period of time to clean it up. Then we have another hearing. No, we have another hearing to declare it a nuisance, and then you set a time when it has to be cleaned, and then there's actually a third hearing to see that it actually is taken care of. So, I mean, these things could drag on for quite some time, and what's going on with these houses, often they change owners. So you may start off with one owner, then another bank gets the note on the property, whatever it amounts to, and then you have to start the whole thing over again. And so actually, like I said, talking to other districts, they don't involve this because it's too cumbersome a process. And that's where we used to spend a lot of time on these things, but then as we got more proficient and our knowledge increased in dealing with this, is that depending on the situation, if it looks like the pool's going to be there for a while and it's not going to be sold anytime soon, we'll use mosquito fish. And mosquito fish will keep the larvae down until a new owner comes in and cleans the pool and so forth. If it looks like there's going to be a transition, we'll treat the pool with larvicides, and then we'll do some follow-up. But actually, we reduce our costs and our time spent working on green pools by using a biological control with the fish.
Okay. Supervisor Munzer?
I guess, Ron, so what is the percentage that we're raising this year?
It's a little over 8%.
Okay, and County Council, we are sure that we can bank these COLAs when we don't use them?
This report was prepared by an outside firm, and we did discuss that with that firm, and they confirmed that we could use the banked amounts and carry it over. It's actually encourages the county not to impose a higher fee, every year, because if you can save that from when you actually need it, then you can impose it when you actually need it.
So how long can we bank the COLA?
It just runs always. Whatever you don't use that prior year, it's counted and it carries on over for the next year. So we did have that discussion with the firm that prepared the report.
Okay.
Sorry, I closed the public comment, public hearing. I'm sorry. Any other questions from the board? If not,
I guess my other question is, can we continue this? Do we have to enact this today? Can we continue this? Do we have clarification on whether we are allowed to bank the COLAs? Because that sounds strange to me also. Do we have to go forward on this, or can we research this
I know there's a
little bit
time
more?
frame when for the tax records, they have to be prepared by a certain time.
I think it's August, though. I think we can continue this to the next hearing.
And then we have
Yes.
clarification on this
Because I believe that they
issue?
don't need to be placed until the second Monday in August on the tax rolls. So we can continue to the next hearing. Yes, and we can confirm that issue for the board.
Supervisor Barrios?
Thank you, Mr. Chair. We really have been discussing this for several years. I've been on the board for over 4 years, and every year it comes back. And I was aware, and I'm very confident that, yes, we can bank these percentages. And so I don't have a problem moving forward because I know that we have asked council in the past. It has been confirmed, it's been verified, and I don't see that this is an issue. So thank you, Mr. Chair.
Mr. Chair, if I can, I'd like to make a motion that we continue this to a date certain of July 23rd.
At 9 a.m.?
Yes.
That's fine.
Okay, I have a motion to continue the item.
I'll second the motion, Mr. Chair.
Okay, I have a motion and a second to continue the item to date
July 23rd at 9 a.m.
July 23rd. All those in favor say aye.
Aye.
Aye. Oppose?
No?
Survivor? There's 3-2. We'll continue it to the 23rd. And that's it. Okay, we'll move on to the next one.
Thank you, Mr. Chair. Next item is going to be presented to us from Margie Riopel. She's a management analyst. She's going to be holding a public hearing in regards to establishing a new fee schedule for the Emergency Medical Services Division. Margie?
Thank you. Good morning. As our CAO has already stated, it's the request to implement a new fee schedule for services provided by the EMS division to approve the ordinance and fees based on a methodology developed by Muni Financial user fee report for San Benito County in 2006. The purpose of the ordinance is to establish fees to offset the costs provided by the EMS division in enforcement of state statute, rules and regulations in relation to the protection of the public and emergency medical services provided. The authority of the ordinance is contained in California Health and Safety Code, Division 2.5, and California Code of Regulations, Division 9, Title 22. In your packet, there's a justification of the fee schedule that has been prepared for your review and consideration. For your references, the tables identified herein are from the Muni Financial User Fee Report and their methodology. Table 12.1 supports the fully burdened hourly rate of the staff for the Emergency Medical Services Division, includes salaries, benefits, indirect costs, and central overhead allocations. Table 12.2 identifies fees to implement for your consideration, and 12.3 reflects the full cost recovery amount for fees allowed as per the methodology used. An ordinance has been prepared for your review and consideration. The new ordinance would adopt the fees. The new ordinance would also provide an option for an annual CPI adjustment that would require County Board of Supervisors approval by resolution. The ordinance and the EMS schedule of fees is attached for your review, attached to the ordinance. Also attached for your consideration is a summary of the ordinance for your approval of a display ad that is pursuant to Government Code 25124B to publish a summary, to do a quarter-page display ad and publish that 3 times rather than the full context of the ordinance. That would be quite lengthy. So today, the actions required are to hold a public hearing and receive comment, to adopt the ordinance establishing a new schedule for Emergency Medical Service Division and authorize the chair to sign same. And the third action would be order that a display ad be published pursuant to Government Code 25124B. I'm here to answer any questions, as well as the EMS coordinator and Health and Human Services Director. If you have any questions, we can answer.
Okay. Any questions from the board for Ms. Riopel? If not, I'll open the public hearing. Anybody from the public would like to comment on this item? If not, I'll close the public hearing.
Mr. Chair, Margie, what does a fully burdened direct labor? For
Yes.
example, the secretary says it's at $112,565 or $66. What is that composed of?
It's composed of several things. It's composed of the full salaries, all the benefits, indirect costs. That means operation and maintenance for the division, and this is the same methodology that we used on the last few fee schedules, and actually most of them the county has implemented.
And the central OH, is that overhead allocation?
That is the cost plan.
Okay.
Okay. Any other questions from the board? If not, I'll entertain a motion.
Mr. Chair, I'll move to adopt ordinance number 919, establishing a new fee schedule for the Emergency Medical Services Division, and authorize the chair to sign same, and order that a display ad be published pursuant to Government Code 25124-B.
Second?
All those in favor say aye.
Aye.
Opposed, hearing none. We'll move on to the next item, which is a general plan housing element progress report, and this is not to be confused with the general plan report later on in our agenda.
That's
Mr. Turner?
correct. I wanted to clarify that as well. There'll be another item on the general plan update later on your agenda. This is regarding a progress report on our general plan housing element. The state government requires that the county submit an annual report on the progress toward implementation of our housing element to the State Department of Housing and Community Development every year. This report is required to describe what degree the county has met its regional housing needs allocation. The attached report, which describes the activity during 2012, uses the format directed by HCD and provides data on building activity of housing on various types. The tables in the report show information such as the number of units built for each income level, funding programs, if any, used to assist development, the extent of rehabilitation and preservation of units, and the overall satisfaction of our regional housing needs assessment allocation. Excuse me. And the progress implementing the programs of the housing element. Our current housing element was adopted by the board in 2010 and was certified later that year. We will be bringing forward a new housing element in 2015 will be due, and we'll start work on that in 2014. At this time, it's recommended that the board hold a public hearing to review the general plan housing element 2012 progress report, and then direct staff to submit the report to the State Department of Housing and Community Development and the Governor's Office of Planning and Research.
Okay, any questions from the board?
Just a comment, Mr. Chair. Thank you so much for bringing this forward. This is something that I think a lot of us may not think about. We always think of having housing for people being able to buy a home that they can afford, but it really goes beyond that because it includes shelters as well, like the Emmaus House, like the winter, homeless shelter that we provide during the winter, and even weatherization, so that people can have an affordable home that they can live in. So I appreciate that this was, brought forward, and I know we need to do this every year, but it includes a lot more than just, the simple how many homes were built. So thank you, Byron. Thank you,
Okay.
Mr. Chair.
Okay, any other questions?
Mr. Chair?
Okay.
Maybe Enrique or Maria can provide this, and I could provide it at a different time. I'd like to get a report on the weatherization program. That $44,000, where did it go to? I don't need it today. Just email me, Enrique. I'm good with that. I just want to see, because my understanding was there was no more of those programs, no more of those fundings out there, and so I was kind of shocked and surprised to see it last night when I was reading it last night. So that's all.
Okay. I was looking at table A3, and this is the annual building activity report summary for above moderate income units. And I guess number of units permitted for above moderate was 7. And then mobile homes, there's 1. How could a mobile home be above moderate, If I was above moderate, I'm not living in a mobile home, but is it?
Well, apparently it was valued that way, so I can't. It must have been a nice mobile home.
Wow. Okay. Must be a nice mobile home. Okay, I'll open up this item for a public hearing. Is there any comments or questions that we could answer from the public? Not, we'll close it and bring it back to the board. I think we need to.
I will make a motion, Mr. Chair. Let me just get to that. That we hold a public hearing, which we have, and direct staff to submit the report to the State Department of Housing and Community Development and the Governor's Office of Planning and Research.
Second. All those in favor say aye.
Aye.
Opposed, hearing none. We'll move on to our last of the public hearings.
Yeah, this particular item's item number 30. This is going to be given us by our Public Works Director, Steve Wittry, and this is to hold a public hearing in regards to the San Benito County AB 900 jail expansion project mitigated negative declaration, and we have Adam Goldstone here.
Good morning, Chair and Supervisors. Earlier on the agenda, you did authorize a contract for architectural services. At this point now, we are asking you to approve the CEQA determination. The AB 900 jail expansion project does require a CEQA review and environmental determination of the proposed project. A mitigated negative declaration has been prepared by a consultant and was circulated for public review for the required 30-day period. They have taken some comments and altered the plan accordingly. Staff is requesting that the board conduct a public hearing for this and adopt the mitigated negative declaration, the CEQA findings that are listed in the report, and the mitigation monitoring and reporting program that goes with that. We're here if you have any questions on any of the report.
Any questions from the board? Okay. The only question I have is that this is right on schedule for our milestones that we need to meet with the jail.
Yeah, with regards to this piece, the CEQA, it's actually a bit ahead, but overall we're doing
ahead?
fine. Yeah, the CEQA
Good.
component, I just wanted to get it done and
All right.
make sure there are no surprises as we head into design. So it made sense to do it a little bit earlier than the state was requiring.
Okay, very good. I'll open up the public hearing. Anyone from the public would comment? If not, I'll close the public hearing and bring it back to the board for an action.
Mr. Chair, I'll move that we adopt Resolution 2013-54, adopting the mitigated negative declaration and related CEQA findings and the mitigation monitoring and reporting program for the jail expansion project, and authorize staff to proceed with the preparation of construction, the documents for the jail expansion project.
Second.
All those in favor say aye.
Aye.
Opposed? Hearing none. We'll move on to our regular agenda.
Thank you.
Item 31.
Thank you, Mr. Chair. Yeah, this particular item will be presented to us by our Director of Health, or Interim Director of Health and Human Services, Maria Corona, and she's going to be giving a presentation on eligibility and enrollment under the Healthcare Reform Act.
How do I get this to work? It's ready, but how do we turn that on?
She needs time to put it together, so they're recommending a break.
All right, we'll take a 5-minute break.
I'll call a meeting back to order. I think we're ready for the presentation. Ms. Corona?
Yes, we are. Good morning, everyone. I'm Maria Corona, Interim Director at Health and Human Services Agency. And today I'm going to be talking about the Affordable Care Act. I have a slideshow that I will be sharing with everyone. As you all know, there are many components to the Affordable Care Act and how it's being implemented, governed, and funded in California. However, today's presentation does not seek to address all these components. Today's presentation will be solely focused on the eligibility and the enrollment piece of the ACA and our role in the aspect of the law. So let me see. I put it. The presentation overview, I'm going to be talking about the Affordable Care Act basics, the governance, the eligibility operations, timeline and challenges, some of the implementation activities, and some of our outstanding needs. As we all know, we're under a very ambitious timeline. Even though this was passed, a couple of years ago, it's been until this year that it's been in the works with the state and the feds and the federal government, but it's actually this year that we are actually moving forward for the implementation. Open enrollment starts October 1st for ACA. It's approximately about 84 days from today, and coverage begins on January 1st of 2014. Affordable Care Act passed in 2010. Various market reforms are already effective today. For instance, access for an uninsured with pre-existing conditions, coverage for young adults until age 26 on a parent's plan, coverage for preventative services such as mammograms and colonoscopies, and the two new mechanisms for expanding coverage are the Medicaid, or known as Medi-Cal expansion, and the tax-based subsidies through the state-based exchanges. The Medi-Cal expansion, currently we have the 138% of the federal poverty level. As you could see, it's 15,856,000 for a single adult to qualify for Medi-Cal, and 32,499 for a family of four. The new eligible under the expansion would be childless and non-disabled and non-elderly adults. Currently, for Medi-Cal, children, pregnant women, the elderly, and people
in San Juan. Is there any need to maybe have someone in that office for an hour or a couple hours a week or something?
I think the need's always there. I think it's always great to have outstation workers as many places as possible. However, it's sometimes there's our capability of going out there and just taking applications versus having the system sometimes delays the process a little bit more. But we could certainly look into seeing if we could expand or have, someone do some intake applications out there as well. What we've done in the past also, we've shared a little bit of how to take an application with some of the staff that are already on site. And then we train them how to take applications, and then what we do, we pick them up or have them transferred to our office, and then we initiate the process.
All right. Yeah, I just want to plant that seed, get this done right, and get with the program, but then maybe in time expand and see if the feasibility for some sort of eligibility worker in San Juan might be reasonable.
And we could certainly look into that, but keep in mind that the workers still have to process the eligibility component. And back in the day, we used to do it all by hand. Now it's all done with the computer. And that sometimes, it hinders our ability. I mean, there's the benefits and disbenefits to it. But we could certainly look into it.
Okay, thank you.
You're welcome.
Yeah, Maria, we have 9,184 potential clients, right? That's a number that we're expecting to have that we don't have that high a number of eligibles now, do we?
That's what we have right now.
That is what we have. That's like 16 to 17% of the county population. How does that compare with the state of California? Matt, I would think that we were probably higher than the average state eligibility in percentage.
I don't have that.
You don't have that? I'm just wondering because of our high
unemployment.
unemployment.
It could be. We do have very, very high unemployment. And due to the recession statewide, we did see an increase in food stamps applications, and CalWorks applications, and in Medi-Cal, of course. But to have the actual percentage in comparison, I don't have that information.
Okay. And I think my concern would be that because we have all these new eligibility, numbers or opportunities, that number's going to increase.
Oh, yes, most definitely, yes.
Do you have any idea of how much more how many more people we may be serving with a new eligibility?
I know that I'm looking at least an increase of at least 3 to 5%. I'm estimating it's probably going to be a couple of thousand more people.
Yeah, that's 20% of our county will be needing or will be eligible for services.
And I'm concerned. I'm concerned because if you look at the ratio of caseloads per staff, it's going to be it's going to be very high. Okay. And I mean, we're going to have to draw down some of the funding. We have some carryover from last year that we explained to the board a couple of months ago, and we're hoping to get more funding from the state to be able to meet their needs. And this is being voiced at the state level. And we're not the only county with the same concerns. I know our neighbors, Monterey County, for instance, I've spoken with Elliott, and they also have concerns as how we're going to be able to handle the influx of caseloads with the staff that we have.
Exactly. Okay. Thank you, Mr. Chair.
Thank you. I guess you can continue,
please. Okay, great. Now I will talk a little bit about the operations will work, starting with the automation. As I mentioned, there will be many ways people will access healthcare coverage. For us, this is not new territory because we have people already seeking Medi-Cal, CalFresh, and CalWorks and services and so forth. What is new is how our operations will interact with Covered California, newly established online and telephone eligibility and enrollment operations. Covered California, along with the Department of Healthcare Services, chose to build a new computer system and phone and service center rather than leverage the computers and phones the county already have in place across the state. An agreement was reached to interface and communicate between the systems, and I'll talk a little bit more about this in a few minutes. As you know, our county has the C4 system. There's a couple others listed in it, but we use C4, and it's fully integrated between Medi-Cal, CalWorks, and CalFresh. The new system that's being built by the exchange is known as CalHERS, which stands for California Health Exchange Eligibility and Retention Project. And it will include the online portals, rules of engine, exchange plan selections, and the Medi-Cal plan selection. As you could see, I have in parentheses delayed. The Medi-Cal plan selection of the CalHERS program is delayed. Even though the enrollment is going to start October 1st, the actual systems are not going to be able to talk to each other until January 1st, which means that from October till December, those 3 months, our staff will need to interface with 2 different systems, CalHERS and C4. Once the integration is completed, then it will avoid from having staff to use 2 systems. There is a concern because the delay of the interface could have potential customer service and workload implications. So we're aware of that. We're working as to how we're going to be handling that. It's an issue that's very concerning, statewide with the implementation of ACA, but this is just the way it's going to be until both systems interface, and they're hoping that the interface will occur on or about January 1st. Let me see if that's right.
Supervisor Munzer?
Maria, so the state is not ready on their part to implement this, but they expect us to be ready on our part to implement this.
Well, they're ready to do the enrollment, but they're not ready to do the actual interface between the 2 systems.
So as I said, the state is not ready to for their part, but they want us to be ready. Why am I not surprised by that? Thank you, Mr. Chair.
Well, what concerns me about that, are they going to pay us for everything that we're doing right now and implementing this program? Are we to get paid?
We're going to be, yes, we're going to be, there's an allocation being provided to all 58 counties.
So the money that we're working out of is off of advances, because that's what scares the heck out of me, is that we're funding your department and somehow other monies that should be going to other things, and we're going into a program that, like Supervisor Munzer mentioned, the state's not even ready, and how do they account for the efforts on the local bottom level and reimburse us for this program, state or federal monies?
Yes. I understand your concern, but the allocation's been there, and the state, the state's told us it needs to be implemented. We're going to address issues as they come. Are we nervous? Are we scared about it? Yes, we are. It's a huge, huge project. I'm very concerned about the increases in caseloads. I'm concerned about the staffing. We voiced these concerns. We're going to have to draw some of this money. The allocation's been done. We're asking for some more. And they promise that they're working on some methodologies to be able to provide us with the adequate funding to be able to make sure that this works.
Because the funding should be in place first, and then we do all this, I would think.
We're going to be drawing down the funding that we do have for this. What this really means is our workers are going to be using 2 systems, and it's our workers that are going to be working harder. And there will be a little bit of delay in serving the customers while we wait.
For the funding.
There's no question that there's
and more funding.
And the important thing is that we're on schedule on our end, and we have a good level of documentation as with the reimbursements, because I could just see the state or federal government delaying the payments. They want us to go into this medical act, which is fine, but if they're not ready on their end, how can they expect us to get reimbursed? Because apparently, I'm pretty sure everybody in the county gets paid, and the cost of providing these services are on a biweekly schedule. Yes, I don't know. Okay.
Mr. Chair, Maria, during the time period in which you have those 2 systems up and running, we're going to invest resources in our employees to ensure that they understand both systems Are you going to require additional hardware, or is it all going to be software applications?
Yes, my understanding is that we are. We're going to require additional hardware, and they're going to be, I'm not quite sure we're going to be having 2 computers, but they are going to be able to have access to both systems.
And then once this, I don't know what you call it,
The
concurrent
interface?
period, or once this period in which now we can just use one system because the C4 integrates with the state system, once all that is, once, you know, the handshaking is okay and everything else can move forward and just implement everything on one system, what happens to all the other software and hardware that the state brought down? Is that just...
No, I mean, we already have a CalFresh and CalWorks and Medi-Cal interfacing right now.
Okay.
There's just going to be a new element, which is going to be CalHears added to that interface. Right now, they're not ready to interface it, so they're going to have to look at 2 different screens per se. But once the integration's done, it's not going to, we're just going to add into the C4 system.
Oh, okay.
Because I mean, it's not, we're not getting rid of anything, it's just going to be added onto the C4 system.
Any other questions from the board? Okay, thank you. You can continue.
Okay, so this one, it talks a little bit about how the call centers are going to be working. Cover California will establish 3 customer service call centers which any California resident can access through an 800 number. 2 state-operated centers and 1 county-operated center in Contra Costa County. Those eligible for Medi-Cal will be referred to the county service center through a warm handoff. So the warm handoff basically what means if someone calls the 800 number, they will probably go to one of these 3 centers that I just mentioned. Once the determination is made, whether they're going to be eligible for Medi-Cal or private health insurance or, you know, the subsidized program, one of the agents going to do a warm handoff. In San Benito County, we don't have, because of our size and infrastructure, it's not feasible for us to receive the warm handoffs or have like our own call center. We are among the 26 counties not taking warm handoff calls. What this means is that some of our residents who initially seek coverage through Cover California's 800 number will be warmly handed off to another county that is accepting such calls. And for us, it's going to be Monterey County. We're in the process of establishing an MOU with Monterey County. They're going to have a call center that's going to be operating longer hours and on weekends, and they're going to be able to take the warm handoff from the actual state call center. This does not mean that they're offloading our work, our San Benito County residents, to the Monterey County call center. What's going to happen is that the county will do an initial intake and then transfer the case to us, and we will be conducting the ongoing case management for our residents. I know this sounds a little bit confusing. It's all new to us, but basically they call the 800 number, a determination is made, warm handoff is sent over to Monterey County call center, and then it's transferred over to us.
Mr. Chair, are we going to have an MOU with Monterey
We don't
County?
have that yet. Elliot and I are still waiting for further direction from the state in terms of what the MOU needs to look like, because it's going to be coming from them as to what's going to be expected. But we're working on it.
Okay. And will we have to pay Monterey for
Yes.
this? We will.
Yes.
Okay.
And there's an allocation included for that.
For that coverage. Okay.
Supervisor De La Cruz has something.
Thank you. Sometimes I get this managed care confused with Obamacare.
Yes, I do too sometimes, believe me.
I mean, and I think my question is that now. You mentioned about exchange. Is your department also managing the exchange too?
No, that's the exchange is being managed by the Covered California.
Okay, Covered California.
Yeah, it's called Covered California.
And that's the Obamacare?
Yes.
Okay.
Yes.
And the Covered California, is that like a, how can I put it? Is it like, it's a managed care too, right? Basically, same scenario, same kind of billing structure like a Medi-Cal program, but it's different. It's a federal program, right?
It's a federal program, and in Covered California, it's an entity that's going to be providing health care options for everybody and anybody within the whole nation.
But this 800 number will determine if you're eligible for the exchange or for Medi-Cal, right?
Yes, yes.
So
They will do a screening.
So either way, whichever way the pipelines you're going to go through, you're still going to be handled such as a same type of culture, same type of flavor in this case, real soft word, like a Medi-Cal type of program, right?
Yes, I guess to some extent. If they're eligible for our programs, they're going to be coming to us.
Got it. Okay.
Okay. All right, I guess we can continue.
Okay. That's sliding down.
I know
Let
what
me
you're gonna
see. The question is no longer whether a client is eligible, but rather for what is he or she eligible for. The evolution of our operations and the way that interact with the state's new operations is a culture change for all of us. As we ensure the all doors lead to coverage approach, enroll people into all available coverage, we strive to provide first-class customer service and coordinate with other services for which people might be eligible for. This concept is known as a horizontal integration, which I will say a little bit more in another slide. We are tasked with developing a renewed outlook about how we are to serve our new and existing clients. As you could see here, all doors are going to lead to coverage. Enrollment is available to all. We're going to be doing some in-house training as well with us because we are going to be striving to improve our customer service within the agency. As you could see here, we're in the Center Human Services Department. We've got it, we're all going to be talking to each other. We've got the MAGI Medi-Cal. MAGI stands for Modified Adjusted Gross Income, which is going to be looking at the income to see whether they're eligible for Medi-Cal or MAGI Medi-Cal. Covered California, then the Human Services programs. And I'm going to talk a little bit more about the horizontal integration, but just to give you a little bit of information, what that basically means is that once they call either the 800 number or they come through our door, we're not just going to be screening them for a Medi-Cal or a health care option, but we're also going to be screening them to see if they're eligible for food stamps or any other services that are provided within the agency.
Hey, Maria, Mr. Chair, I got a question. If you qualify for, say, for example, for the cover or the exchange, and income, a situation and the family happens, and then and then you actually qualify for Medi-Cal, is there like a whole new application process you go through, or is it just a phone call or simple input in the computer and automatically a couple numbers are changed and you become Medi-Cal eligibility?
For new eligibles, there is an application, and the state said they're simplifying the application, and they're also simplifying the eligibility criteria. A couple of slides ago, I mentioned that they're not going to be doing the assets test, which is, they're not going to be looking as much as they used to look at bank accounts or property or what have you. The application of itself, I saw a draft of it. I was hoping to see an application that was, 3 or 4 pages long. This one was 13. So I was not too impressed with that. And we did voice our concern about that. This is supposed to be simple, and they're still working on it. But anyways. Expectations of County Human Services is to understand the new eligibility rules and options, accept warm handoffs. Of course, I explained how the warm handoff is going to be accepted through Monterey County from Covered California Call Center. For us, is provide ongoing case management for all Medi-Cal programs and to enroll customers into all programs for which they are eligible, such as CalWorks, CalFresh, Medi-Cal, a process known as the horizontal integration. Counties are in agreement with the administration on a funding plan. Let me see. Counties are receiving $240 million in each of the next 2 years, 2013-14 and 2014-15. This should cover work associated with the ACA eligibility, and it should cover warm handoff staffing between counties and Covered California. The state will also be working on permanent methodology for the third year, 2015-16 and beyond, in collaboration with administration.
Now, Now, Maria, back to this 15, 16, because, you know, anything that comes out of Sacramento, there's just no guarantees you can get that same amount of money coming in. That can really put the county at a burden down the road.
I'm sorry.
Well,
I didn't hear
we're
you.
guaranteed money for the next 2 years, right?
Yes,
And then the question is moving forward.
yes.
And if the state, you know, they could always balance, you know, their checkbook, or could always have a balanced budget by, you know, not funding mandated programs, and this is one of them right here. So if in 15, 16 they decide just to give, instead of 200 million without an adjustment for increased costs, and just decide to go with the 150 million, then the county's going to have to pay that difference.
I'm hoping not. You got, you know, 58 representatives, county representatives there, and we are all voicing our concerns, and we're hoping that rather than seeing less money, we see more, because this is new, and we're still, you know, we're still going to be assessing and evaluating what's going to be needed, and I'm sure that we're probably going to be needing more resources and more funding to be able to meet the demand.
You know what the best course of program is, Maria? I think that the state should bring all you guys as state employees. Let the state fund every single program. And then if they want to do cutbacks, it's at the state, not at the back of the county local taxpayers. I think that's the best solution. Yeah.
Okay, we'll continue with the report.
Continue,
Like that
okay.
idea.
Let me see, it was number 15. The horizontal integration, I want to briefly, I talked a little bit more about it, but I'm going to, you know, restate it again. I want to touch on the horizontal integration a bit more because it will affect so many of our residents. A large percentage of CalFresh enrollees who are not currently receiving Medi-Cal will now be eligible for a health care plan under the new expansion. And likewise, a large percentage of newly eligible Medi-Cal recipients will also be eligible for CalFresh. So we'll be looking at both programs at each application that comes through our doors. So this is the timeline. Outreach has been ongoing. A lot of us already know that this is coming, or has been coming for several months yet now. County staffing estimates are being developed. We've already requested some staff, and we're in the process of hiring new staff. October 1st is the day where the enrollment will start. Warm Handoff County, Department of Health Care Services, and Cover California agreements are being completed. Training for CalHERES and eligibility changes, it's in process right now. Pre-enrollment, October 1st, and then health insurance coverage begins on January 1st, and this is the expansion timeline in a nutshell. The key challenge is, and Supervisor Munzer, you said that at the beginning, late start by the state on key decisions, and that's one huge, huge challenge that we have voiced our concerns about to the state. And then the funding's now coming through to the counties. Of course, we wanted to see the funding 6-7 months ago, but that didn't happen. There's still some outstanding rules from the state and federal government, so we're waiting for further direction in terms of the eligibility components and what have you. And then the delayed automation, which is the interface, and those are some of the challenges. However, you know, we're going to be working through this, and failure is not an option, and that's what the state is telling us. We're going to work through this, and as challenges come up, we will be addressing them. Some of the things that we've used for implementation support are an implementation guide, which was released in February. Framework for advancing a culture of customer service in health and human services agencies. We've had ongoing webinars, which I've had several of my staff participate in, regional seminars, and currently, of course, we're doing inventory of current assessments and future needs within our agency. Implementation needs in our county, we're hiring new staff, we're going to be doing training, new and existing staff, purchasing technology, prepping the facilities. We're outgrowing our facilities, so we're looking at accommodating the newly hired and future hired. As funding permits, we expect to hire more people. Implementation of policy, business, and process changes, and responding to unfolding information in short timeframes as they become available. This is the last one. California County Human Services Agency will provide first-class customer service to individuals seeking help under the Affordable Care Act and will enhance local agency culture to effectively promote health care coverage and access to vital human services for all who are eligible. And that is our vision. And that concludes the presentation for today.
Okay, thank you. Is there any other questions or comments from the board? Any questions or comments from the public? Please step forward, state your name for the record. Of course, we know who you are.
Marty Richmond from Hollister. I suggest on this program we pull a Vietnam. We just declare that we've won and go home. So we are late in implementation because the state didn't get it there. We don't have the money because the state didn't pay us. The computer system that was supposed to do it isn't going to be online, but we're going to do it somehow on time. Let me tell you what you already know in a nutshell. The cost of the implementation has been underestimated. The schedule is all wrong. Anyone who remembers, they say in the National Football League to be a good cornerback, you have to have a short memory because you can't remember when you got beat last time. Obviously, to work in the state of California, you have to have no memory at all. Do you remember how long it took to put the C4 system into effect? How many years it took them to procure that, to get it installed, and to get it integrated, and all the problems we had with that? But no, with a late start and underfunded, they're going to have this one running in January, which is already late. So they're already forecasting late. January 2014, maybe January 2015, who knows? I'm sure that the people at Human Services, Health and Human Services here are going to do the best they can. But I think we ought to be prepared if you want to make it. You better be prepared to find some money to throw at it because you're going to need more people than you thought to handle 2 computer systems at the same time, which are not going to be online as promised. They're already delayed, so we're already late. And 13-page applications and all the rest of it. I guarantee you this is going to cost a fortune, and $240 million for 58 counties, 38 million people is chicken feed. Chicken feed. This is going to be the Bay Bridge times 8. The Bay Bridge was supposed to cost $1.2 billion to fix. It wound up to be costing $6.4 billion, and a couple of years late. Now we're going to do this all over again. So if you're going to do it, and I know you're going to do your best, you better be prepared to find some money. I don't know where, because that's the only thing you'll be able to throw at it. Or we'll be back to 900 people on the waiting list, and I'm not blaming our local Health and Human Services for that. Remember when we had 900 people on the waiting list because we couldn't get the system running fast enough, the intake fast enough? That's exactly what's going to happen in this case. As soon as the ball gets rolling, the people who want to be in the system are going to pile up much faster than the system is going to be able to process them. And everybody who's late will eventually be. Of course, I could save you all this overhead money. I'll wrap up my last idea. Just take the dollar bills, put them in a pickup truck, drive them over to Health and Human Services, and tell everybody to take whatever they need. Thank you for your time.
Thank you. Anyone else?
Marvin Jones, Hollister. Don't have an eligibility question. Since I've had my 75th birthday, the magic number in Obamacare, any of my major health issues will end up going before the death panels. My question was more on scheduling of another item. At the end of March of this year, first quarter of calendar year 2013, we were all to have received our implantable device for storing our medical records. I did not get mine. I'm not aware of anyone that did. Do we have any schedule on when we will get implanted with the micro device for storing our medical records? Thank you, sir.
Thank you.
Good morning, Chairman Botello, Supervisors. My name is Christina Chavez-Wyatt. I'm a San Benito County resident and Executive Director of the Business Council. I am working in a collaborative group with the Community Foundation, Healthy San Benito County Initiative, the Healthcare District, and the Business Council and the the Chamber of Commerce to host a community and business workshop on Tuesday morning, September 10th at 7:30 a.m. at the Community Center, including speakers from Covered California. We're hoping to get some folks regarding the implementation of Obamacare, and hopefully we can get some experts here from the county to provide information and resources, including our doctor community, et cetera, on the new wellness programs and implementation and how businesses can work to conform to all of the new rules. So I just want to offer that as a resource, and as soon as the information and details are available, we're providing that to you. Thank you.
We really appreciate that. Thank you. Anyone else from the public? I'll close the public comment and bring it back to the supervisor's comment on the report. It doesn't look like there's any further comments. I just hope that we keep track of the funding and make sure that the funding stream goes to this particular program and hopefully doesn't steal from any other programs that we have in place, and it certainly can't come from the general fund. And maybe at some point in time we might have to be waiting on the state to make some key decisions and provide the revenue for these services, because I honestly can't see how we could get out in front of it either. And please keep the board up to date as with the progress or issues that may arise.
Certainly, yes.
Okay. Thank you. We'll move on.
Thank you, Mr. Chair. Yeah, the next item on our agenda is going to be item 32. This is going to be presented to us by Enrique, our Deputy Director at Health and Human Services. He's going to be presenting to your board the 2013 San Benito County Homeless Census Report. And Enrique?
Thank you very much, members of the board and the public. My name is Enrique Arriola. I'm Deputy Director for Community Services and Workforce Development. As an official member for the Salinas, Monterey, San Benito County Continuum of Care to end homelessness for the last few years, Community Service and Workforce Development under the Health and Human Services Agency participated in this year's homeless census, which took place on January 23rd. The Homeless Coalition led the local efforts with the homeless census, along with a number of other organizations and volunteers on this particular day. The county participated in this day as well by counting and documenting and completing the survey to all individuals residing at the shelter the county runs, the emergency shelter for homeless families. But I wanted to allow the Homeless Coalition, the Executive Director, Cindy Parr, to give you a quick overview of what transpired that day, January 23rd, so that you have a good idea of the efforts that took place. I also want to make the public aware that we have the presentation on the back and also the homeless census report. It's for those that are interested. So I want to introduce Cindy Parr, the Executive Director of the San Benito County Homeless Coalition.
Good morning, thank you. Cindy Parr, Executive Director of the Homeless Coalition. I want to first start with a few statistics. I know Peter Connery is going to go over those, but in 2005, when the shelter first opened, there were 16 individuals identified as being homeless in our county. In 2011, we did a census, and we identified 193. This year in January, 365 were identified. So I just we hope to repeat those numbers so that they stick with everybody. But like Enrique said, we started with a point of time on the 22nd of January where those that were sheltered were counted. The morning of the 23rd, we met up at the shelter at 5 o'clock in the morning, and we went out in groups. There were 5 groups. San Benito County has 5 tracks. So each group had a homeless guide with 2 volunteers to go out, and we went out literally on foot and driving around. And we count individuals, RVs, anybody that we can see living in habitable situations is where we got our numbers from. We also did some surveys, and for our next count in 2015, we know that I feel like we failed with the surveys because we missed a lot of numbers, but we know now that we will do a better job next year as we're learning. But that's the process that it took for us to get these numbers. And now I think we're going to bring up Peter Connery from ASR, Applied Survey Research, who actually put the report together for us.
Thank you, Cindy. Thank you, Chair, members of the board. As Cindy mentioned, we are reporting on the 2013 homeless census and survey results. And this is part of a national effort which is done every 2 years in odd years, where communities throughout the country, all in the last 10 days of January, assess the size of their homeless population, both sheltered and unsheltered, the results of which are then aggregated, and a report is made to Congress, and there are federal allocations of dollars which then get awarded based on a grant application system called the Supernova, and local communities such as San Benito and Monterey County are served from that work. ASR is a nonprofit research and evaluation firm based in Santa Cruz, and we've been doing these technical assistance efforts with counties throughout the country since 1999. As Cindy mentioned, one of the cornerstones of good counts like we think we performed in San Benito and Monterey counties this year is the importance of involving the local community, and that includes the currently homeless themselves. We began that in '99. And then in addition to the importance of having peers involved in the process, because of the challenging nature of finding homeless folks on the street, we also feel it's very important to develop customized strategies for some of the subgroups within the homeless. And we found that, for example, in 2005, that we were missing a significant number of unaccompanied homeless youth. So dedicated efforts were set up to discover those folks, which also led to other customized outreach services like veterans and families and service workers and farm workers. The purpose of the count, as we mentioned, is to is in large part, it's federally mandated, but there's a lot of other value as well. It's important to generate valid and accurate data regarding individuals and families in the community. Important to retain funding for homeless through federal sources, through faith sources, and other public and private sources. It's important increasingly to show progress and measurement of said progress or lack of progress. Also really important and a key reason we're here today is to increase community and jurisdictional understanding of homelessness. There's a lot of myths, there's a lot of ignorance about homelessness in every community that we work in, And these types of reports are an opportunity to educate the public and describe some of the needs and reasons why we should intervene and help. And then very importantly...
Second, sir, Supervisor Munzer has a question for you.
Yes.
In our packet, and I don't see it in your PowerPoint, it talks about that 365 individuals were counted, and from that, if I'm reading this right, you estimate that 1,153 people are homeless?
Yeah.
How do you jump from 365 to 1,100?
Okay. Well, I could jump forward to some of the results on that. Can you bear with me?
Oh, okay. Okay.
Yeah,
I'm sorry.
I'm gonna get to that in a
Okay,
second,
all right,
and I
thank
can
you.
kind of describe. It's a kind of a complicated path to discuss, but if you give me a sec, I'll get there.
Okay, thank you.
So I'll just quickly go through the approach to the PIT counts. Participatory. There's a three-step process. There's the census, which is the documentation of the unsheltered homeless. Cindy mentioned how that was done with volunteers and the peer teams. And then there's the shelter count and also wait list, where we, as Cindy mentioned, which was done on the 22nd. And those two components give us the number of homeless in San Benito County at a given point in time. Very important to, and I'll get back to that. Then, following the actual quantification of homelessness, then there is a survey sample which develops a more detailed profile of some of the background and behavioral and demographic issues that are experienced by the homeless. And that data is very important and mandatory in the national reporting to HUD. So I'll get to your question, Supervisor Munzer, on this slide right here. So the point-in-time count result for 2013 was 365 persons. But one of the challenges to thinking in terms of point-in-time count results is that it doesn't accurately reflect the number of people who experience homelessness over a given year. So, for example, in the last 10 days of January, there were 365 homeless persons that we counted. But by June, by July 9th, maybe 100 of those original homeless that were counted on January 23rd will have found their way out of homelessness or moved on or whatever, but in fact they may have been replaced or additional persons would have become homeless. So using survey data and some statistical formulas that were developed by the Corporation for Supportive Housing, there's a formula which converts the point-in-time result, the 365, and projects what the number of unique individuals who experience homelessness over a given year. So some of those variables include average length of homelessness and homeless 7 days or less. But the net of it is, when those values are added in, it's estimated that over the course of a calendar year, there are 1,153 unique people that experience homelessness.
Supervisor Munzer?
Okay, so you're not saying that on the day you went out and counted 365 individuals, that there was additional 800 that you didn't count. You're just saying that over the course of the year, that 800 more people will experience homelessness.
Right.
Okay, I'm sorry. I misunderstood
yeah.
that. Okay.
In terms of budgeting, we like to think in terms of annualization of the phenomena, because people set their budgets to an annual an annual amount. So sometimes you don't always get the real picture of the phenomena by just looking at that narrow point in time.
Okay, thank you, thank you.
So of the 365, a little under 2/3 of the population are unsheltered. 35% were sheltered. It should be noted that that 365 is pretty much a specific minimum. There are absolutely folks that we know that we were unable to find in our efforts on the 23rd. There's folks living on private property in remote rural spots, encampments that we didn't have access to. We know, for example, that there's a large group of service and farm workers that live in outbuildings and abandoned structures and in tent encampments that we don't have access to. And I know that it's set as a future improvement area for the count to try and quantify those folks. So there are efforts underway to be more outreach oriented to some of those groups, and when we get into future pit counts, we think we'll be better able to quantify those.
Mr. Chair?
Yeah.
If you go back to the graphic, what you're saying is that 35% of shelter they're sheltered through the services that the Homeless Coalition does, or is that just a combination of so many other options?
Yeah, I'm not, I'll let Cindy take care of that. Go ahead, Cindy. She can tell you what the
So the
infrastructure is.
35% that were sheltered were from the Emmaus House, the winter shelter that the county runs, and the Homeless Coalition.
Now, did you do an additional questions, or maybe I should wait, where those are actually Hollister residents, San Miguel County residents, or people moving from different parts of the area?
I have a slide
In the
that
report,
covers
yeah,
that.
I'm going to let Peter do that too.
So we're getting into some of the details of the population. Race and ethnicity, you can see the background there. The gender in San Benito County was roughly, pretty close to 50-50. As you can see, in most counties we work in, the ratio is more heavily in the male to female side. Supervisor, this is the slide you were asking me about. We did ask about residency and where the residency was when they most recently became homeless. 88% responded that they had lived in San Benito County before becoming homeless. And then 8% in another county in California, and only 4% were from outside the state. So there's a big concern, and we talked about myths earlier. Many communities have this concern that if homeless infrastructure is built, that people from out of town will come and dominate those services. We shouldn't serve folks that are not homegrown. The documentation shows that it is a homegrown phenomenon. First-time homelessness, 53% of those that were surveyed said this was the first time they had ever been homeless. Primary cause, this is self-reported. 27% lost their job. 10% income, argument with family, friends, 17%. Divorced, another family issue. Mental health issues, 8%. One of the things we try and do in our work, and because it keeps coming up in all the survey work that we come up with, that homelessness is as much a medical situation as it is a housing situation. And the medical needs, both physical and mental health and substance abuse, are significant.
You know, it's funny, Mr. Chair, it's funny you say that because I kind of felt that the medical health condition should have been maybe 2 or 3 up in that bar, and that's.
Yeah, I mean, it's the sort of thing where some of it is a little chicken and the egg. I mean, some people, they lost their job because of physical health and absenteeism issues or substance abuse or mental health issues that make socialization and coping in the workplace more challenging. It's a lot more complicated than a simple graph can really communicate. Current medical needs, dental care, just, you know, everybody, almost everybody needs some dental services, eye care, Medicare, medical care, substance abuse, significant mental health. Disabling conditions, 28% have chronic depression, 22% physical disability, PTSD 15, substance abuse 9, mental illness including bipolar conditions or schizophrenia 9%. Again, these are all self-defined, and historically they tend to be underreported, so it's probably even worse than this. Current assistance and support, there's good distribution of food stamps, but as you can see, there's a significant shortfall in some of the other services that might be available to them. One of the areas that HUD focuses on in particular in the triaging of homeless services that goes on nationally is a focus on subpopulations, and in particular chronic homelessness is one of the current top groups, and that is a category which includes a length of time for homelessness as well as a disabling condition. And 185, roughly 50% of your homeless in the county are classified as chronically homeless, who are the most cost-effective or cost-intensive group, as well as the most difficult group to serve and get out of their homeless situation. Of those chronically homeless, 50% were unsheltered, a little better than your general population. Veterans, 21, there were 21 veterans that were documented, 86% of whom, which obviously not a big number, but still significant, were unsheltered. Families and unaccompanied children, roughly a third of the population were persons and families. Fortunately, most of those are sheltered. Youth is another group. This is an area for improvement. We think we can do better in the future on this. 13 youth were identified. And as you could get a sense from Cindy and Enrique and others and Tom Melville from the Homeless Coalition, these types of research efforts take a tremendous amount of community involvement and outreach and planning and logistics, and there's just a long list of folks to thank. Community services and workforce development, they called a lot of folks on waiting lists. The Homeless Coalition, Cindy and her group in particular were right at the tip of the spear on this whole effort, rallying volunteers, recruiting currently homeless folks that would invigorate the program and increase our outreach efforts. And it was a big day and one that paints a pretty solid picture of homelessness in San Benito County, and an effort that we hope to improve on even more in the future. I'll be happy to take any questions.
Is there any questions from the board? Not any questions or comments from the public? I think
while Marty is stepping up, it's pretty apparent that we're not going to get to the general plan update till after lunch. So just for
I'll try and be brief.
information.
Mr. Chairman, Marty Richmond from Haussler. I have a little bit of a complicated question, so please bear with me. It's for the gentleman who presented the statistics. For the point in time count for 2011, we had 193 and we had 365 for the point in time count in 2013. And I think he mentioned that they did better coverage. So obviously you're going to get a better count, more accurate count. I wonder if they tried to look at, if they had done the original coverage in 2013, take that number and compare it to what they got in 2011, so they can determine how much of the 2011 either moved or was missed. In other words, we're looking for a trend line. Well, if we keep doing better coverage, the trend line will always go up. We understand a lot of people have been missed. But if you did an apples-to-apples comparison, in other words, if you only counted the people at the locations in 2013 that you counted in 2011 at those locations, how would that look? Does that make any sense? In other words, apples to apples, the same location. I understand that we get better coverage. Does that make any sense? Is that a question?
Yeah.
I wonder, could you answer that for me? Do you know?
Why don't we wait till all the public comment is in, and then maybe we could get up and answer the questions all at one time. Is there anyone else from the public would like to ask a question or comment on the report? Okay, seeing none. Go ahead and answer a question now. I'll close the public comment.
Okay. The questioner is right in that the methods do in fact determines the results to a large degree. It should be noted that in 2011 we covered the whole county. We had less resources and less knowledge of where homeless were than we did in 2013. So as far as getting to a true net gain or net loss in the number of homeless persons between 2011 and 2013, I don't necessarily think we could do that. What we can do, though, is we can see that San Benito is not significantly different from many other communities that we work with throughout California. We also help Monterey County, obviously, Santa Cruz County, San Luis Obispo County, Santa Clara County, San Francisco County, Sonoma County, all of whom have very common economic challenges that San Benito County has. And in general, we've seen a trend from 2011 that things have remained relatively static, with some changes plus or minus 5% in the last 2 years. I don't know if that's the case in San Benito County or not. Santa Cruz County, as an example, increased almost 30% versus what they experienced in 2011. Los Angeles County, some of you may have seen, saw a 16% increase in their homeless population from 2011. So the rules on this count consistently change. For example, double-ups are people that are staying with friends or family that have no other place to stay. Those folks are specifically excluded from the pit counting rules per HUD. But all our indications throughout the communities we work in is the number of people that are in double-up situations has grown very significantly, maybe 30, 40% in many cases. So that's another phenomena that unfortunately isn't documented, and those families and individuals that are living in those double-up situations are accessing homeless services throughout the county and elsewhere. So it is a challenge to get an accurate number. We stay consistent from count to count. We try and improve, and there always will be a certain amount of unknown relative to the impact of improved methodology.
Any questions? Oh, okay. I have one more speaker card, Mr. Emerson.
Thank you. My name is Doug Emerson. I'm chair of the board of the Homeless Coalition. I just want to take a very brief moment to invite all of you and everybody out here to our annual fundraiser, Jazz Under the Stars. I'm sure you've heard from me.
I bought 2 tickets.
Great, and I know Anthony's bought some tickets. Anthony's contributed 2 cases of wine. We want to thank you for that. The Homeless Coalition, we're very fortunate. We just received word recently that we have a emergency shelter grant coming directly from HCD, and that's going to fund the majority of our winter shelter. As this board is well aware, we are contracted to operate Helping Hands, which is a HUD grant for permanent housing. Those 2 grants largely support our efforts, but each one of those grants requires local match. Each one of those grants covers very little of our administrative costs. So Jazz Under the Stars is our primary fundraiser to cover a lot of those costs, and we would invite everyone. I've got flyers here. July 27th, 6 o'clock, St. Benedict's. You can actually go online to SBC Homeless Coalition. Make a donation there for the tickets. It's $50 a ticket. Thank you.
I'm happy you made that point, Doug. It is a fun event. I was out there last year. I know other supervisors were there as well, and I highly encourage everybody to get out there and enjoy a real good time. Good food, good wine, and great entertainment for a great cause. Sir?
Good morning, and thank you. My name is Tom Melville. I'm the Executive Officer for the Coalition of Homeless Services Providers. I'd like to thank the San Benito County Board of Supervisors and Chair and members for your continued leadership and compassion and involvement in addressing homeless issues. In 2011, San Benito County became part of a larger continuum of care that now also includes Monterey County. We have a 10-year plan to address homelessness called Lead Me Home, and a leadership council, and we're very pleased that Supervisor Margie Barrios represents the San Benito County Board of Supervisors on that leadership council. And change on these issues, which we all hope could happen yesterday, are slow, but by working together, by keeping at it, it does make a difference. In 2011, because San Benito County was part of the continuum of care, I think received, was it 189?
207.
Oh, even better, 207,000 for new resources. And as Doug, you just mentioned, this past year, 2012, I believe got $133,000 for the shelter program. So by working together, by sticking to it, again, ongoing compassion, leadership, to include Health and Human Services here at San Benito County, Enrique's involvement, the Coalition of San Benito County, it does make a difference. So thank you for your leadership, compassion, and guidance on these issues.
Okay, thank you. Enrique?
Just final comments. I want to thank you, and I'm hoping you do accept the report as presented. The issues here in San Benito County relating to homelessness are wide. This report here, I'm very proud of this report. I think everyone did a fabulous job in having this report completed. However, I still believe, as Mr. Peter Connery mentioned, there's a population that's not represented here, and I know we could certainly improve every year. I think it's hard to compare apples to apples as we move forward, but we could only get better. We did receive some resources that helps with this, but as part of the 10-year plan to end homelessness, our goal is that someday there will be no homelessness. We still have a lot of needs here. We have no permanent shelter facility. We have a lot of gaps, so with your support and the support of the public, I'm sure we'll get a step closer. Thank you.
Thank you. Supervisor Barrios?
Thank you, Mr. Chair, and thank you for this report. Although the report is wonderful, our work is not done. That report, we don't want it sitting on a shelf because we really need to use that to be able to find the solutions that we need to have in order to address homelessness. The greatest thing that has happened to San Benito County is to partner with Monterey. Had we not done that, we would not have received the 207,000 and later on the 130, I believe. It matters that we're together with another county, being regionally connected. The numbers are greater, we'll be recognized, and perhaps, we'll get more funding in the future. I really believe that this board should really make an effort to work with our farmhouse housing, farm worker housing that we have to provide year-round homes for the homeless. I also believe that we can utilize it for day use, where they can have a place to call home during the day. So there's a lot of opportunity. We just need to be able to get creative. So I encourage us to do that, because these numbers are only going to increase if we don't do something now.
Exactly.
So thank you, Mr. Chair.
Okay, thank you. Any other comments from the board? If not, I'll accept a motion to accept the census report.
I make a motion to accept the census report as presented.
Okay.
Second.
All those in favor say aye.
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 Opposed? Hearing none. Thank you again. Thank you. And we'll look forward to being there on the 27th. We'll move on to the next item.
Thank you, Mr. Chair. Yeah, the next item is going to be presented to us by Joe Paul Gonzalez. He's our clerk, auditor, recorder. He's going to be presenting to you a report on SB 391 and requesting your board for a letter to be signed. Joe Paul.
Chair, members of the board, today before you as the county recorder, this agenda item is an item that came up at the County Recorders Association, that the County Recorders Association has asked all the recorders to go to their respective boards and ask for support in opposing Senate Bill 391, which is entitled the California Homes and Jobs Act of 2013. This bill was submitted or introduced by Assemblyman DeSaulnier, and basically what the bill is another one of the many, many attempts that the legislature has tried to address the problems with affordable housing and with the demise of the construction industry as a result of the termination of all the redevelopment agencies throughout the state. So last year, Senate Bill 1220 is almost an identical bill to this bill 391. And what this bill does is it adds $75 per transaction to all the fee payers in the recorder's office related to property transactions. It only exempts transactions related to the purchase of a property. Any of the documents that are recorded for purchase of the property are exempt. But, for example, a reconveyance where the person has gone out and received a loan to pay off an old loan, maybe got a better rate as a result of the HARP program, the federal program, they would be paying under SB 391 $75 per each document that gets recorded as a result of that reconveyance. And the reason I'm here today is to ask the board to, I'm sure everyone has looked at the report and has seen all the points related to this bill that increases the cost to the fee payers, adds a tax to every fee that is added, that is charged to the users. So, for example, a person who is a contractor recording a lien for unpaid services, they would be charged an additional $75 for this tax on top of the fee for the service. You know, a widow who is recording an affidavit of her husband's death on their property, they would be charged $75 for the recording for the tax on this recording. A person who buys a $1 million home would pay 0 tax on this type of on SB 391's taxes. I've included in the report a fee impact specifically to San Benito County. What would you expect to see in the county if 391 is successful? For example, a deed of trust, currently the fee is around $54 to record the deed, and all the related documents that get recorded in terms of a refinance, the current fee on average is $132. With SB 391, the taxes assigned on top of those fees would be $582. We estimate that this SB 391 would bring in about $900,000 of, or actually take out of San Benito County $900,000 in taxes, and that would be, you know, funneled up to the state level. And because this legislation is being presented, I think, in probably one of the most dire of economic times that the state has ever seen, it doesn't really make sense to try to tackle the affordable housing problem and the construction industry problem using this methodology, this tax. I think the merits of their, you know, they have very good intentions with this bill, but I think it really, you know, causes unintended consequences. And the biggest reason why I brought this before you is because by adding a tax to what the Recorder's Office already does, you know, performs, it will cause people who cannot afford to do these additional recordings to have that, to miss the opportunities to keep their title to their properties, to keep them whole. A person can buy a home, and if they don't record the proper documentations in the Recorder's Office, they still own it. But now they have to go outside of the Recorder's Office, which is, all our documents are public. They have to go to the court system to be able to prove their home ownerships. So it really is a disincentive for people to perform all the requisite recording of documents with regard to home ownership. So I'm here before you to ask you to accept this report and to ask the board to direct the chair to sign a letter of opposition, which is attached in your agenda packet, and to forward this letter to the Assembly Committee of Housing and Community Development, and in addition to the other legislators that are on that committee. And I'm available for any questions that you may have.
Is there any questions from the board? Any questions or comments from the public? I'll bring it back to the board for an action. I think it's pretty obvious.
It is.
Can I have a motion?
Mr. Chair, that we accept the report on SB 391 from our county recorder and direct the board chair to sign and forward to the members of the Assembly Committee on Housing and Community Development the attached letter of opposition to SB 391.
Second.
All those in favor say aye.
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 Opposed, hearing none. The next item, I think we're going to have some discussion on, and I was wondering if the board wishes maybe break for lunch now and come back at 1. And that'd probably be the wise thing to do. So we'll adjourn for lunch. and come back at 1 o'clock to continue the regular agenda.